Hi, and welcome to Getting Pumped for Open Enrollment 2021. Gypsy and I have worked really hard this year to try to get you through the Health Check 360 process in a phased approach. So hopefully that's worked for you. I do want to stress if you have any questions or concerns to please let me know. But that being said, I'm going to go ahead and go through the open enrollment slides for those of you who were not able to attend one of our live sessions. Important dates, open enrollment will close in Workday at 4 p.m. on Friday, November 6th. I always say I'm not kidding about this. It is a very, very strict rule. We have those deadlines in place so the vendors can get everything in place for you for January 1st. It does take a lot of work on the back end to get all of that settled. So I just want to stress that. Your last day to screen is November 6th as well. So please get those done as soon as possible. An important announcement, we will be getting new medical insurance cards this year, and that is because we had to make a change on the back end. It doesn't affect anything at all. It's just wording within our documents had to be updated. So that being said, we have to issue new cards. So please make sure that your address in Workday is correct so you can get your new medical insurance cards. It will come in an envelope from UMR and it will go to whatever address is listed in Workday once those open enrollment files start going over to the vendor. So please make sure that's correct. However, if you forget and accidentally throw it away, you can still use your old insurance cards. They'll still work. But I just want everybody to be aware that those will be coming. A few of the highlights, I want to reiterate, there's actually no benefit changes this year. All of our plans, everything are staying the same. We have one new vendor, that's it. Due to 2020 plan costs, employee contributions will be increasing for the medical insurance plan only by 5%. We've had a lot of utilization. We're actually currently running at 98% of our 2020 budget, and that is even with COVID. So another rough year, but in order to recover those costs, that is what's due to the rate increase. We'll continue to offer RX and Go. There's a new insulin program for 2021 that I'm very excited about that we added. Direct Path Advocacy Program continues. I will take you through an example of that. Delta Dental will continue, no rate increase. Same for iMed. We're locked into those rates for several years. Of course, Lindenwell will still be a very important part of our new vendor Health Check 360 intermedical insurance plan. All of our ancillary coverage will continue with Mutual of Omaha, and we have a new administrator for the flex spending, and they're called P&A Group, or as I like to call them, Panda. So, as far as Health Check 360 goes, there's a couple things that I wanted to address. Again, this deadline to screen is Friday, November 6th. If you're scheduling at a LabCorp, you have to go through the Health Check 360 portal because at the end of that registration for your appointment, they actually provide you a printout that you'll have to take with you to LabCorp. It's specific to you. It has your information on it. So I have no way to provide that to you. So please make sure that you go through and bring that printout with you. If you don't, then you will have to contact Health Check 360 and they will work to get you what you need. But again, I don't have the ability to do that due to HIPAA. Or you can print out the physician form as shown in the helpful videos that we sent out and bring that to your doctor. Then you'll have to upload those results back into your Health Check 360 portal. You can also fax those results to your doctors if you see more than one doctor, or if you went to LabCorp, you didn't go to your doctor for that. And I actually did that. I went to a LabCorp back in September, had my Health Check 360 draw completed, and then I went ahead and faxed those to my primary care, my neurologist, and my primary care doctor. When I went in for my annual a few weeks back, he said that was everything that I needed. So I didn't even have to get a second blood draw. The one thing I want to address are blood pressure results. We've received a lot of feedback this year regarding blood pressure results not being accurate. We hear you, I promise. There is an appeal process for the blood pressure results. Please know that this is not unique to Lindenwood. When I reached out to Health Check 360, they stated this is across the board. All of their clients are having the same issues. So a few of the unintended consequences of COVID are that a lot of times people are waiting in their car, or you walk right in and they have you sit down right away and take your blood pressure. So there's no time for you to rest. And then they're also rushing to get you in and out of there as quickly as possible. The reason being is they are trying to limit all of the possible exposures that people may or may not have. So they're trying to get people in and out of there so you spend the least amount of time around people as possible. And so, with that being said, it is a very simple appeal process. I've actually had a couple employees already let me know that they've gone through it, told me how helpful Health Check 360 was and how easy it was. So I promise you we'll get you through it. While the deadline to screen is Friday, November 6th, the deadline to appeal those blood pressure results is November 20th. So keep that in mind. We also lowered the score from 75 to 65. So you only have to get a 65 or higher in order to maintain that wellness rate for 2021. Okay, so the 2021 campaign year will begin in January, of course. Challenges from Lindenwell will begin in February 2021, but it doesn't mean that you can't start entering points and things into your portal before then. I'm not going to go into too much detail about that because my main goal is to make sure that everybody registers in Health Check 360 and gets their screening done. And then we'll start sending out that communication, and we'll also have sessions set up to teach you what you'll need to do in 2021. So if you've completed your screening, then you can relax for now, just like Jasmine is doing here. You will, again, need to earn points in 2021 to maintain that wellness rate for 2022. But that's basically just a disclaimer. We want you to chillax for now. Regular communication will always be shared via Lindenwell email from Mariah Gove. And those wellness seminars will begin probably in the January, February timeframe. So I just like to go over this during open enrollment as a reminder. Your deductible, if you're on the plan by yourself, is $1,000. It's $2,000 total, whether you have 1 or 20 dependents on the plan with you. So if you have 4 kids, one of them breaks a leg, they're going to hit the deductible. So then there's just $1,000 left for you to hit. That other $1,000 that makes up that $2,000 total has been met by that one kid who had the broken leg. So I don't want you to think it's $1,000 per kid. It's $1,000 cumulative, and then $1,000 for you. You won't have to worry about out-of-pocket maximums unless you have a serious health condition or you've been in an accident. Physician's office for preventive care. So if you go in for your flu shot, which is highly recommended this year, or annual physical exams, women's wellness exams, anything like that, those are covered at 100%. Physician's office visits, it's a $20 copay for your primary care and a $40 copay for anybody with an allergist at the end of their title. Emergency room, urgent care visits are listed there. And then, of course, our retail pharmacy is usually $12 for generic, $40 for brand, and $75 for non-formulary. Telemedicine, hashtag best thing ever. We have seen a huge utilization, especially during COVID, but even before COVID, we had a 33% utilization rate on this. So I'm very proud of that. Everybody's been using it. Telemedicine there's a $0 copay. It's available 24/7. So basically what I recommend doing is if you're new to the plan or going to be new to the plan, then you'll have to wait for your effective date. If you've been on the plan, I would go ahead and recommend doing it now. Their information is also available on the back of your medical insurance cards. So what you'll want to do is go to teladoc.com, and they'll ask you you'll need your medical insurance card because you'll need your ID, and then they'll ask you where you work, and they'll match all that up. And then what you can do is you can set yourself up with an account. And by doing that, you will put in a pharmacy and your primary care physician. So the benefit of doing that is when you're under the weather or sick, then you can literally just call them up and you can get a call back within an hour from a licensed medical doctor, and they can actually prescribe you medication over the phone and have it sent to your pharmacy. So you don't have to go anywhere. You can stay in your jammies because you're probably already not feeling well, and you can have all of that done. Now, I just want to reiterate that it is for acute conditions only. If you break a leg, this is not the route I would take. So infections, cold flu symptoms, bronchitis, things like that. A lot of people have been calling because they haven't been feeling well, making sure and seeing if they need a referral for a COVID test. So I just want to put that out there. It's also a $0 copay. So please take advantage of that. This is, again, just a flyer. This is the flyer that's available in Workday that you can access that has some of the things that are covered, teladoc.com, web address, and then the phone number if you need to call. So the 2021 employee medical contributions are as follows. As you can see, that everything did go up 5%, and that does include on the non-participant rate. So the non-participant rate is $75 more a month plus the 5% increase. So I want to make that clear. I've gotten a lot of questions about that. Rx and Go Pharmacy benefits. If you have forgotten about this or you're not using it, you should. It is for free generic maintenance medications by mail. Seriously. You may receive up to 90 days for qualifying medications at no cost to you. And I'll show you in the next slide where you can go to see if your medications are covered. It is separate from UMR's mail order program. So you can't call UMR and say, hey, I want to use the Rx and Go benefits. It is a third party. So I just want to make that clear. I get a lot of questions about that sometimes. But our employees saved $54,000 in 2020, and that's at $12 a medication. So if you go to the pharmacy, you can only get 30 days at a time. That's an FDA regulation, and you have to pay $12. So just one prescription a month at $12 is $144 a year, which is the cost of just one rescue Chihuahua. So save a life or treat yourself to something nice. My point is, why would you spend the $144 on medication when you have the opportunity to get that for free? I do want to reiterate that it is for generic maintenance medications. So things like mood stabilizers, there's a lot of nerve medication available, blood pressure, cholesterol, emotional health. They actually have more than 1,500 generic maintenance medications available. So please check it out. This is their new platform. So you go to rxandgo.com, and then you can click on the medications tab and you can search by condition, or you can type in the actual name of your medication. Usually condition is a little easier because it'll lay it all out there for you. There is a new insulin program that is available starting in 2021. So you have the option to receive insulin medications, Humalog, Lispro, Novolog, Levemir. I'm probably not saying most of those correctly. I do apologize. As well as test strips and test monitors. So it's a $0 copay and $0 shipping. Again, if you're not using it, you're not doing yourself any favors. Okay. Please sign up for this. I highly recommend it. It's very easy to use. What you will do to utilize it is you will get an Rx and Go Pharmacy profile form. These are available in Workday. And you fill out the top portion, your doctor fills out the bottom portion, and then your doctor will submit that to Rx and Go with copies of your prescription. Now, you just need one of these per doctor. So if you see 10 doctors, you need 10 forms. If you see one doctor, you need one form. Then Rx and Go will start shipping your medications to you every 90 days. My only disclaimer on this is that most physicians will write prescriptions for 1 year. So at that 1 year, when you're getting close to that 1 year mark, Rx and Go will reach out to you, but they'll reach out to you by mail. So it's important to know. Every once in a while I get a call and somebody's like, hey, I'm not getting this. And it's always because, oh, you have to go see your physician and have them resend the prescription. So most of those prescriptions are only good for a year. I just wanted to point that out. Voluntary dental benefits, there's no increase for 2021. We'll continue through Delta Dental. They're awesome because you can literally go anywhere you want to have your fangs worked on. Here is the summary of benefits here, and a few things I like to go over. You can see that there's 3 different lines of negotiated rates here. We only have one plan, but dentists negotiate different levels of discounts. So with a PPO dentist, you're going to pay the least amount out of pocket. With a premier or non-participating dentist, you're going to pay more out of pocket. Now you can see with Delta Dental, you can have any diagnostic or preventive services completed free of charge. If you go to a non-participating dentist, however, you're going to have to pay out of pocket, get your receipt, submit that to Delta Dental, and they will reimburse you. However, that difference between that 90 and 80% on like basic or major services, that 10% difference, that can actually get up to thousands of dollars. I, for one, can definitely tell you that. I've had a lot of dental work over the years, and it really can add up. So I just want to put that out there so you're aware. Voluntary vision benefits. Again, nothing's changing on this. I do like to remind everybody that with iMed, they have a Go Green policy, so they will only ever send you one insurance card. I get it. However, we can always get you more electronic versions of your card. So don't fear, we can always get those for you. You actually don't even really need your insurance card. If you let them know that you have iMed, they'll look you up with your personal information and match you to that insurance. This is the summary of benefits. A lot of their marketing materials are a little difficult to read because, at least on a screen, because they use a lot of fluorescent colors, which I normally appreciate, but it does make it hard during orientation and open enrollment. So this is exactly what you see is what you get. However, there's something called the Freedom Pass with the vision benefits. And this is really cool because you're actually eligible to receive free frames from, I think, no longer Sears Optical, but Target Optical and contactsdirect.com. So make sure that you remind your provider of that if you're going to any of those places. Direct Path is a personal advocacy program that we like to push a lot. They can help with things. It's free. They assign a personal advocate to work on your behalf for things like claims and billings assistance, provider searches, deductible assistance, and cost analysis and price comparisons. So as far as the cost analysis and price comparisons, procedure costs can procedure costs can vary dramatically, and your provider is incentivized for referrals for certain procedures. I should probably speak more slowly and then I won't stumble on my words. So you can see on here that things like colonoscopies, mammograms, MRIs, all of these things, they vary in price depending on where you go. I will use the example of an MRI in my next couple slides. However, with colonoscopies and mammograms, those are covered at 100% because those are considered preventive procedures. So it really doesn't matter where you go for those, you'll pay $0 out of pocket. However, you have the opportunity to earn money back if you go through this process. Let me show you. So I call them up and I say, hey, I need an MRI of the brain with and without contrast. I usually give them Lindenwood zip code because I'll go on a lunch break or before or after work. I can usually get in and out of there within an hour. So they'll send you back this report of provider comparisons. You can see that my total estimated cost out of pocket didn't change, but the difference between option A and option C for the employer was about $1,400. So we're actually incentivizing you to pick the lower costing option. Really, an MRI is an MRI. I always go to Metro Imaging. My neurologist office always says, we'll call you to set this up because they want to keep me, they get incentivized to keep me with SSM. And I just say, okay, thank you. And I just do my own thing. So I went ahead and I picked Metro Imaging and I received a what's called an explanation of benefits or an EOB in the mail. Again, these come from UMR, so make sure you're paying attention to those in the mail and that you have the correct address listed in Workday. So this is my actual explanation of benefits. It shows that I went to advanced radiology, which is how Metro Imaging bills, and I submit this back to my caseworker who I was working with at DirectPath, and then they will calculate your rewards based on the highest costing option and the lower costing option that you chose. So in this case, I was eligible to receive almost $300 back. That I basically made back what I had to pay out of pocket. So it's pretty cool. That'll come back on your next paycheck. I get a report once a month. I never know who went for what unless you told me. But it'll just say Candace Terry 277.87. And then I work with payroll to make sure that that's reimbursed to you on your next paycheck. If you ever have any questions on how to use this, please let me know. Flyers are available on Workday. Our basic life insurance, AD&D and LTD are 100% employer paid. So if you're a full-time employee with us, you do get a $50,000 life insurance policy. However, there is an age reduction. So once you hit 65 or higher, it starts reducing. So at age 65, that'll reduce by 35%. I just want you to be aware of that. Accidental death and dismemberment, same thing, up to $50,000, and long-term disability. So this pays 60% of your monthly earnings after you have been incapacitated from working for 180 days, which is 6 months. And benefits are payable until you're either no longer disabled or you reach Social Security retirement age. I do want to disclaim that the long-term disability, the life, and AD&D, since these are employer paid, they are taxable. However, all the voluntary benefits are pulled from your checks post-tax, so they're not taxable. We do this so you can get the most amount of money possible should you ever need these benefits. And it gets you pretty close, especially with the short-term disability, it'll get you pretty close to 100% of your salary. I do want to remind you that evidence of insurability is required for all new supplemental life elections or critical illness elections. Not an option, but I just want you to be aware you will receive an email from Mutual of Omaha that I'll be copied on saying, hey, click here, answer these medical questions. You can purchase this in increments of $25,000 up to $100,000 for yourself. Spouses are eligible for 50% of the employee's elected amount of supplemental coverage, and children are eligible for a flat $10,000. I do want to just reiterate that age reduction of benefits, that would also affect your spouse and children if you have them on the plan. You can only purchase supplemental coverage for spouses and children if you buy additional supplemental for yourself. Short-term disability, this pays 60% of your weekly earnings, up to $1,000 a week. It pays after 14 consecutive days. So it's not 14 work days, it's just literally 14 days, 2 weeks. And then you'll start receiving weekly checks. I think you can elect for direct deposit with Mutual of Omaha as well, but that will pay for up to 26 weeks, which is about 6 months, and that's when your employer paid long-term disability would hit. We also have accident insurance and critical illness. So accident provides a benefit if you or your dependents are injured by an accident. So sprains, broken bones, burns. I recommend this for anybody in operations or anybody who has kids in sports. There is a Mutual of Omaha benefits summary that goes over like what the accident insurance pays for certain injuries related to accidents. Critical illness, again, evidence of insurability is required for new enrollments or if you want to up the amount that you currently have. It provides a benefit if you or your dependents who are enrolled are diagnosed with specific illnesses. So if I'm diagnosed with cancer tomorrow, and let's just say I have a type of cancer where you literally take a magic pill, it goes away forever, it doesn't matter. They will still pay out whatever amount you've elected. So you can buy in increments of 5, 10, 20, or 30. So in my case, it would pay out $30,000. And then I'd live the rest of my life and help pay off my student loans. However, if I'm terminal, they would still pay that out. And maybe I want to spend my last month in Bora Bora. It doesn't matter. You can spend the money on whatever you want. However, you do have to be diagnosed with major illnesses. Again, that is outlined on the paperwork as well. There is a wellness benefit for annual preventive exams. These include things like flu shots, annual wellness exams, colonoscopy, mammograms. So it's another way to earn $50 back. If you're enrolled in the accident, you'll get $50. If you're enrolled in the critical illness, you'll get $50. When my husband would go for his annual exams, I'd submit his paperwork as well. Got another $50 for the accident and another $50 for the critical illness. Notice how I said I got the additional $100 for his preventive exam. That's right. I went ahead and cashed those and bought myself something nice. So just know you can make money back from Direct Path. You can also make money for accident and critical illness, and it'll just more ways to stay healthy. You'll also get points with Health Check 360 for annual preventive exams. So we definitely want you to get those. Flexible spending accounts. The IRS, I actually got the notification this morning. It's Wednesday, October 28th when I'm recording this. The rates did not increase for 2021. This is the first time ever, and I've been administering our benefits for 6 or 7 years at this point. It's the first time they haven't raised it. So it will remain at $2,750 for 2021. It's $5,000 for dependent care. That has never changed. You will have from January 1st to December 31st, we'll take those deductions from your paycheck, but you'll have until March 15th of 2022 to use your 2021 funds. Now, I want to remind you that PNA Group, or Panda, will be our new administrator for flex spending accounts beginning January 1st, 2021. This is another reason it's very important to have the correct address in Workday, because you will receive your new benefit spending card in the mail in late December, early January. So please make sure those addresses are correct. It is kind of difficult, and they do charge you $10 if you lose your card, and we have to reissue you another one. So please be aware of that. That is not my rule. It's not even Panda's rule. That is an IRS regulation as well. Beneflex will continue to manage the 2020 funds through March 31st, 2021. So if you have any funds left over after December 31st of this year, you will still continue to use your Beneflex Benny card until March 31st of 2021. It is use it or lose it. Again, that's an IRS regulation. So you want to make sure that you use all of those funds by March 31st. As a reminder, we do have a benefits committee here on campus. These are all of the folks that serve and assist with all of our decision making. So if you have any questions and you prefer, to talk to somebody who's not me and see what their take on it is, just know that these are the individuals who represent your various departments on campus. I'm going to say this till I'm blue in the face. Important dates. Open enrollment will close promptly at 4 p.m. on Friday, November 6th. And last day to screen is November 6th. However, you have until November 20th. If you're having issues with your blood pressure, again, please feel free to reach out. I do have a form that I can share with you. Again, make sure your address is correct in Workday so you get your benefit cards as well as your new medical insurance cards. And thank you for your time. I am excited to bring you another year of great benefits. I am bummed that I don't get to see any of you in person, but please feel free to connect with me if you have any questions or concerns. Thank you.